All right, Dr. Masri is everywhere. Saw him on MSNBC last night on his return there, updating numbers, what's happening with COVID-19, LSU hospitalist services over at Ochsner. He has been a great resource for our show. Yesterday, we were all kind of out of whack with stuff that was happening over the weekend, and we just kind of ran out of time, so Dr. Mas was kind enough to jump on with us here on this Tuesday and give us an update on what's happening. Remember, anything that you may be curious about COVID-19, anything going on with the pandemic, questions you may have, if you want them answered here on Off the Bench, we usually do it with Dr. Naji Masri every week here on Off the Bench. Good morning, sir. How are you?
Hey guys, how y'all doing?
Doing okay. We talked to Coach Ed Ogeron in hour number one. He's still optimistic about his football season getting up and underway on time, hopefully. Is there any outlook from the medical field in the way that you see football season and how it may go off or may not?
Look, I would never try to challenge Coach O, but there's a couple of things I think that from a medical perspective that we need to have happen before we get there. And some of them are starting to happen. So the outlook is fair, but we need a dramatic decrease in the number of new cases. You know, in the state, we've been going up about 8,000-9,000 cases a week, and we need to see that number really start to plateau and get down. We need far fewer deaths. We have some state and federal restrictions we need lifted, right? We have a stay-at-home order by the state. The CDC had mandated we need no gatherings of more than 50 people. That was issued mid-March, so that's at least till mid-May, and that could certainly be extended. And like I've always been saying, we need more testing. We need expedited results. One interesting study that's being done out in Silicon Valley is a study on a test where you can do a finger stick test for the virus, kind of similar to how diabetics check their sugar. That would be very interesting for sports because that would give an immediate return of results. But then you have to be able to validate it. You got to be able to trust that if it's a negative, it's a true negative. And then later on, some of the aspirational things, I know you've heard probably in the news, antibody testing. That would be something that would show if you have immunity. We need to understand what that means. And then the grand kicker of it all is we're going to have to get a vaccine at some point. There's about 20 companies working on this right now, but a lot of people believe that it's probably a little bit away.
Is that a must? Because I think so, you know, teams traveling into Louisiana, with as bad as we've been hit, I think teams obviously would be shy traveling in to Louisiana to have any kind of sporting contest if you don't have a vaccine.
Yeah, I think we have to look at this as two tiers. I think the first tier is going to be tier 1 pre-vaccine, and that's going to be talking about probably in any team sport, playing for TV, probably no fans in the stands. And that's if you get some of the first couple of things I say. And then tier 2 is really going to be probably after antibody and vaccine testing, where it could be a lot safer for players, a lot safer for fans. I mean, think about it. We're only 4 to 5 months away from football. It's hard to imagine right now in our current environment having 75,000 people in the Dome or 100,000 people in Tiger Stadium coming up in a couple months.
Dr. Masri joining us here on Off the Bench, just like he does every single week. There's a push to reopen businesses around the country. It feels like we've seen some states start to lift the home bans. What's your reaction when you see that, and how do you feel about the state of Louisiana getting back there?
Yeah, it's a tough one. I mean, we're over 25,000 cases in the state, over 1,300 deaths. East Baton Rouge Parish now is over 1,500 cases. It's easily the third most in the state behind Orleans and Jefferson Parish. Alexandria is top 200 cases. You know, I gave a little glimmer of hope last week, and let me push that door open a little bit more and let in some more sunlight. In the last 8 days, each day we've had less and less hospitalizations. Each day we've had less and less ventilators. I think we're at about 340 less hospitalizations than last week and 130 less patients on ventilators. But we just have to be smart about this. Just because things are working, we cannot rush back to the way things were. In the state, we're kind of used to post-recovery, post-natural disaster recovery. But if you go back to Katrina, there was a physical element to it. We saw the damage in our homes, in our city, on TV. But COVID-19 is a little bit different. It's more of kind of a silent killer. Unless you have a personal experience with a family or friend having COVID-19, or you're a healthcare worker, you don't necessarily physically see the damage, but it's certainly there. So it just has to be a graded return.
Is one of the difficult parts about our state in the fact that, you know, kind of the bigger areas, New Orleans, Baton Rouge, and Shreveport, have kind of gotten it all at different times. Like, it didn't really hit at once. Would it have been easier maybe if it all hit at once? Because it seems like it's been, okay, this week and then the next week and then the next week, the three biggest parts of our state have been hit differently.
Yeah, that's true for our state. That's true for our nation, and honestly, that's true for the world. And it makes it difficult. There's a good and bad to it. I guess the bad has kind of been well documented, especially resource, PPE, ventilators, the things you see on the news. The good, as far as us as a state and a country, is we were pretty much the last area to really be hit with this compared to the world. And so the advantage of that really is the ability to have science catch up. We have a lot more data and case reports to go on with this. And the longer we flatten the curve and allow for science to catch up, the better tools we're going to have to work with to fight the disease. But really, it's been hit different. I see a lot of decrease in the numbers maybe in the New Orleans area, but we were the first area that hit. There's still other parishes in the state that are still going up, and that's going to be true for our state, and that's going to be true for our nation. And that's why it's so difficult to really put down and pin down an exact timeline of what to do after this.
Dr. Naji Masri joining us here on Off the Bench, LSU Director of Hospital Services at Ochsner Medical. Doc, is there any monitoring going on from a worldwide standpoint, specifically in China, on now that they are trying to find some sense of normalcy, if there's been any re-diagnosis, if anybody is catching the virus again?
Yeah, so any pandemic that you deal with, there's always a second peak when you relax social distancing and some of the parameters that got you away with it. Back in 1918, there was actually more people that died from the Spanish flu at the second peak than with the initial peak, because of the quick return to the way things were before and the quick hastening of life and economy. So that's something there. You know, if you want to follow the timeline of Italy and China, it was about a 3.5-month stretch where things were kind of stagnated before they really had a good return. Think about it, we're only about 5 weeks in here, at least in our state, and maybe close to 2 months in as a country. So we have a little bit of lag time. And then there's some controversy of whether we can really trust some of the numbers coming out, especially China, as far as number of new cases and things like that. But it's going to have to be something where we're going to have to take it day by day, week by week, and go. But we're going to have to see some change in the numbers that we're seeing right now before we really push for other things in what we're doing.
We'll talk to Dr. Masri next week on Monday. Doc, before we get there, is there a lasting message for our listeners that you want before we hear from you again?
Sure. Keep along the same theme. I know everybody's talking about the Michael Jordan documentary, the first 2 episodes. Look, we're all living season 1 of COVID-19. We're like 4 to 5 episodes into season 1 of COVID-19. We don't know how many episodes are in season 1, and we don't know when they're going to air the finale. And you cannot fast forward. We got to be patient and stay the course. But I want to still offer the glimmer of hope. We're starting to get to the other side of this. We just have to be patient with it.
We always appreciate the clear picture that you paint for our listeners and us here on Off the Bench each Monday. And thank you for jumping on with us on this Tuesday, Doc. Stay safe, and we'll talk to you next week.
Be good, guys. Thank you.
Yes, sir. There he is, Dr. Naji Masri, checking in from Ochsner Health, as he is the director of LSU Hospitalist Services over there. We always appreciate his time and his updates